Well, it's great to be here. I've already been introduced as a professor of landscape architecture, so you'll know that by background I'm interested in designing the outdoor environment. And indeed, my training was very much something that focused on the broad range of outdoor environments. Landscape architecture we talk about as being the domain of anything open to the sky. So from the most urban to the most rural, we're interested in all of it. I know various other people are as well, but landscape architects, you know, we're top of the pile in that respect. One of the issues that is of great interest today in public health, and the focus of this talk, is whether the environment on the left adds to the stresses on your health, on your well-being, on your system, and whether the kind of environments that are perhaps in an extreme version on your right, the green space, makes a difference to that. Now, you won't need to be told that the urban population is increasing. Indeed, it's reckoned that in the first decade of this century, over 50% of the population worldwide was urban. So it's become urban already, the majority of the population. But what you see in this slide is that the degree of urbanization is happening much more rapidly in developing countries compared with developed countries. So here's urban and here's rural in the developed world, and you can see a much more rapid urbanization crossing over with rural dwelling in the developing, less developed regions. So it's been predicted by the year 2050, 70% of the world's population will be living in urban areas, roughly 6.3 billion people. That's almost double the urban population from 2007. And as you might imagine, having seen that graph, a large part of this is the result of vast growth of urbanization in the developing world, particularly African and Asian countries. This is an image that shows the prediction of the top megacities by, these are population exceeding 10 million by 2020. And by 2025, there's expected to be even more, maybe around 30 megacities in the world. So we can see that we've got an increasing urbanized population, and the pattern of urbanization is changing. I'll say a bit more about that in a minute. But one of the issues of urbanization is its influence on people's health. Now, people move to urban environments sometimes for very good reasons due to catastrophic natural environmental disasters that may drive them out of certain rural regions. There may be social instigators for the move to the urban environment, from social problems in rural areas to war, other natural disasters as well. So there's a range of things that drive people into the urban environment. And in fact, the urban environment may be much better for many people. It may offer better access to health facilities, better access to certain kinds of medical treatment that mean people will be better off. But we also know that in urban environments, there are a range of things that make life difficult. This is a lovely graph of the Great Smog of 1952. And I have a special interest in this, which I'll tell you about in a minute. But it's an example in Britain of how an increasingly polluted urban environment, where we were burning coal largely to provide heating and fuel, generally led to a great sulfur dioxide smog that when people looked back on it afterwards, at the time, I think it wasn't quite realized how lethal it was, but it lasted for 4 months. Here's smoke, here's sulfur dioxide, and here are the deaths. Now, this was a while ago. This led to the Clean Air Act in Britain and cleaning up of environmental pollution from coal smoke and coal fire in particular. But in many developing urban environments, such challenges may still be present. The urban environment may be a polluting environment. People may live very close by to sources of environmental pollutions and hazards. The reason I'm interested in this is because this all started on my birthday. And very luckily for me, although my parents lived in London, I was born in Oxford. Otherwise, I might not be here today to tell you this story. Now, one of the other interesting things that's going on worldwide, and this is really just to set the context for understanding how important access to green and natural environments might be, is that actually many cities are also shrinking. There's a number of reasons for this, but post-industrialization, a decline in the economic basis on which many cities have been built up, is responsible for some of this. We also see in a post-Soviet era some Eastern European countries, cities declining as people move to better job opportunities in the West. There's a range of reasons. But a classic example is Detroit. What was once the steel belt of America is now the rust belt. A city that has seen a very dramatic decline in population in recent decades, probably the most famous shrinking city, certainly in the Western world. And whilst you can see a few bits of natural environment creeping back in there, and I'll come back to this towards the end of the talk, it creates an environment that is sort of rather Gothic, perhaps even sublime in its grandeur as it falls apart, but certainly not an environment that might make you feel good about life, good about living there. And the challenge with these shrinking and post-industrial cities, and we have some in Britain as well, Glasgow, Manchester, is that the environment may be adding to stresses that are already there for other reasons, economic, social. So if you have a poor environment on top of all of the rest of those, that may be adding to the health challenges. And those of us who are interested in green space, landscape planning, environmental planning, the jargon these days is ecosystem services, what can green space do for you, have always been interested in sustainability and natural systems being an important part of global systems. But we have a new urgency now underlined by the World Health Organization, who have got into the description, the definition of sustainability, the idea of equity of access to good health. For development to be sustainable, it must benefit the health not just of people now, but in the future. It must be equitable. In other words, to put it more bluntly, you shouldn't be challenged, your health shouldn't be worse simply because of where you live within a particular country or particular region. We know in practice, of course, that certainly isn't the case, but that the ideal for a sustainable environment and for sustainable development is that it offers equitable access to things that support good health and doesn't offer inequitable access to things that might damage your health. A lot of the focus on environmental health and environment in general in relation to public health issues until quite recently in the late 20th and early 21st century was on environment as hazard. And I'll mention this again in a minute. But there's been a recent re-evaluation of the importance of environment as something that might support healthy lives rather than just offer problems and challenges to us. And the Marmot report, based in England, underlined this, some of the jargon phrases of public policy about social inclusion, but perhaps also environmental justice, and I know you heard about that a bit in your last lecture, are very important. Environmental injustice is reflected when people who don't have access to good environments are challenged in other ways as well. So if we want to look at the positive effect that environment can have on health, we need to understand sustainability in this broad definition. I'm not going to explain this diagram to you, and I know it's quite hard to read, but it's just to underline the fact that the relationship between environment and health is not simple. And there are a great many challenges to studying it and researching it, and I'm going to tell you a little bit about those in a minute. But we also need to understand our own history to recognise where the challenges have been in the past and recognise that sometimes we don't learn from history. Of course, the link between environment and health is often mediated by, the physical environment and health is often mediated by the social environment. And a Glasgow slum in the 19th century might offer a very polluted environment in terms of air quality, a very restrictive environment in terms of physical space, fresh air, light, opportunities to access the natural environment, but might possibly have been quite a rich and supportive social environment. When we look at a Glasgow slum, this is from 1990. I could have shown you images from 2012 that might not have looked much worse than this. Much better than this. If the environment is poor socially and physically, then we're in a double bind. We have a double challenge. And how you feel about where you live makes a difference to your health. One of the best predictors of quality of life and people's perception of their quality of life is how they perceive their environment, their neighbourhood, the place where they live, and the places around them. So what are we doing about that? Well, I'm grateful to George Morris, who has worked in public health in Scotland for a number of years, for the following slides. In an era of sanitary statistics back in the 19th century, when people thought that poisonous miasmas coming from and foul odours coming from swamps and decaying areas were responsible for illness, the response to this was to recognise the importance of environment, of place, and to deal with this by improving sanitation. In an era of infectious disease epidemiology, in the late 19th and early 20th century, up until the Second World War, the germ theory identified single agents as responsible for specific diseases. And the action was sanitation, isolation, vaccination, antibiotics, but nonetheless recognised the importance of environment, of place, of isolation and sanitation. I've already shown you the result of this smog. This is an image of the famous 1952 smog. In this age, the late 20th century, environment has often been seen as hazard, and the action was to control the environment and the emissions, especially gases, into the environment. But we're now in what George Morris has called a black box era. We've got fantastic technology in medicine and able to do wonderful things. But the link between a person, their lifestyle, and how we treat them has, until comparatively recently, sort of lost sight of the environment. The intervening factors have sometimes not been considered fully. There's been a focus on behavioural risk factors and on the individual and on changing behaviour, and we still need to focus on that. It's not to deny that. But you'll be aware of the obesity epidemic and the concurrent problems of type 2 diabetes, poor cardiovascular health, a whole range of issues to do with our physical health that we're not coping with very well in the urban environment. But also in terms of mental health, there are increasing problems. And at a European level, it's reckoned that in any one year, about 27% of the population experience some kind of mental disorder. 83 million people. That's a huge number. So how do we approach this? How do we deal with and understand and perhaps challenge some of these or deal with some of these challenges better? It's not easy. This is just a different version of that more complicated diagram I showed you earlier. But the ecological approach that is favoured now in terms of the kind of public health research, certainly that I'm involved in, suggests that we need to understand the environment at all levels. Bronfenbrenner's ideas of the individual and then the environment, social and physical, that are nested one within the other out to the broader global ecosystem. And we need to recognise that the social is important as well as the physical environment, but nonetheless the physical environment matters too. So there's been a burgeoning growth in the 21st century. There really has been a very fast growth of interest in looking at the environment as potentially a positive rather than a negative influence on our health, and a whole range of new research programs developed to explore this, some of which I'm involved with myself and some of which colleagues are. And I'm going to give you a flavour of the next little bit of the talk of what some of this research is showing. Richard Mitchell, someone I've been working with based in Glasgow, has been looking at the link between cardiovascular mortality rate, that's what's up the y-axis here, and how green the environment is around where you live. And you can see a very clear association that is statistically significant between being in a greener place and having a lower cardiovascular mortality risk. So there is a direct association, and it's a strong one. What's interesting also is that it seems to mediate the effects of poverty. One of the best predictors of how healthy or unhealthy you are is how poor you are. And if you're poor and you lived in a deprived context, then you are much more likely to be unhealthy than if you're wealthy and live in a very affluent context. So you see here in the least green areas that income group 4, the poorest people, have a much higher incidence of poor health than the rich people. But in a green area, a much more green area, that slope is much less. What we see is that the difference between the poor and the wealthy is much reduced. So green space, in some way, having lots of green space around where you live seems to make a difference to that gradient, seems to reduce the effect of poverty on health. Some research that Richard is involved in with us at the moment for Scottish Government is looking at a more individual country level relationship between neighbourhood green space and health. And although the picture is slightly messy, you're getting a similar picture here. We're seeing that this is percentage green space in your neighbourhood environment. So in England, the more green space you have, the lower your risk, this is lower risk down here, of cardiovascular disease. It's the same, slightly more messily in Northern Ireland. It's more clearly seen here in Wales. We have to be different in Scotland. It's not such a clear pattern there, and one of the things we're researching at the moment is trying to understand exactly what is going on with this in this relationship, if any, between green space and health in the Scottish context. But Richard has also worked with colleagues internationally, including some based here in geography at Edinburgh University, and associations between accessible green space in a neighbourhood and cardiovascular disease mortality in New Zealand doesn't show a strong relationship either. So we're not alone in Scotland. But one of the suggestions is that it's more complex than simply more green space, cardiovascular disease. And I've suggested already that there's a range of subtle interactions between physical, social, and mental health. And one of the bits of research that has been done looked at the mental health effects of being active in natural environments. We know that being active is good for our physical health, for our cardiovascular health, but what about mental health? And Rich Mitchell looked at the Scottish Health Survey data from 2008, which among other things asked people for what kinds of physical activities they did in a typical week and where they did these. And they were asked to identify a range of places that they had been to do their activities. The kind of activities might be walking or cycling or gardening or whatever. And you can see that some of these are green and natural environments, woodland, open space, non-tarmac paths, beach or riverbank, and some of them are urban, more urban. And those green listed places here, if I just go back, these were statistically associated with better mental health. In other words, if you were physically active in a natural open space, then you had about half the risk of poor mental health of people who were physically active but not in a natural space. each additional use of any natural environment per week was associated with about a 6% lower risk of poor mental health. And this underlines research from other people who've done research in England looking at the effect of exercise in different contexts, in urban environments and in natural environments, and suggest that there's something about the natural environment that is a sort of additive to the beneficial effect of exercise on physical health. Now, this isn't new in one sense. I said, do we learn from history or don't we? In one sense, we knew this 150 years ago, more than that, 180 years ago. We've sort of forgotten it and are rediscovering it. London's parks were first labelled the lungs of London in the 18th century by William Pitt the Elder in Parliament. And in the early 19th century, the idea of public parks being the lungs of a city resonated. They were written about in Edinburgh, in London, in New York, across Europe. And Victoria Park in London was started because of a cholera epidemic in 1831. And reform was needed. People were living in very close back-to-back housing with very little space, very little natural environment, very little access to open space. And you can see from these quotes here from the first half of the 19th century that people were imagining that access to green space, to public open space for the workers who were otherwise living in very cramped conditions and also right next often to polluting industries would actually make an enormous difference to public health. Now, it may be that in our Western, in our developed world, the challenges from the urban environment are not the same in terms of pollutants that they were in the 19th century. But nonetheless, there is a recognition that these kind of parks that Joseph Paxton famously developed, Birkenhead outside Liverpool, one of the first public parks bought by the use of public money for public access, were seen as important contributions to public health. And in North America, we see a very similar pattern. People were impressed by what was going on in England and across Europe, and Frederick Law Olmsted and actually an English architect, Calvert Vaux, plan for Central Park, New York, was developed to try and create better and healthier conditions for all classes, including the working classes. And actually, it's interesting, if you look at what Frederick Law Olmsted was writing in the 19th century, you will see it actually seems remarkably modern. The artificial conditions of the town would produce a harmful effect, first on a man's entire mental and nervous system, and ultimately on his entire constitutional organisation. Overexposure to the artificial sites of the city would lead to excessive nervous tension, over-anxiety, a hasteful disposition, impatience and irritability. And the antidote is pleasing rural scenery. Now, in a minute, I'll talk about current theories about what's going on in the link between green space and health, but actually this was remarkably prescient. This showed a very good understanding of, expressed perhaps in 19th century terms, of actually what we think is going on today in our relationship with the green and natural environment. And people like Olmsted and Vaux produced pleasing rural scenery, such as this long meadow in Prospect Park, Brooklyn, that is designed to be, he was actually trying to create a sort of green English ideal pastoral scenery for the residents of New York and Brooklyn, but seen as an antidote to the urban ills of pressurized urban living. And sort of sympathize with that today, can't we? So by 2007, we see that the Royal Commission on Environmental Pollution in Britain, for example, has clearly recognised that green space is good for health. And one of the interesting things about this kind of environmental approach is that you can get a population-wide effect. The challenge of looking at individual behaviour and trying to change individual behaviour, if you want to benefit people's health, is that it may be effective if you can do it cleverly, but you need to work at each individual to have that effect. Whereas if you can change an environment in a way that has a positive and beneficial effect on people's health, it can change that health it can have a much wider effect on the population with one intervention, at least potentially. So we'll see here that instead of environmental pollution, as I suggested before, being seen as something that was the environment as a problem, the environment as hazard, the environment as polluting. And if you go and Google environment and health today, chances are that the first websites that come up will be ones that talk about all the pollution, all the pollutants in the environment. And in many parts of the world, those are still an important issue, so we shouldn't ignore that. But nonetheless, this idea that actually there may be salutogenic, health-inducing environments instead is growing favour. So what's behind it? It's one thing to demonstrate epidemiologically that if you live near more green space, you're healthier than if you live near less green space. Certainly true for some populations, a suggestion, and I'll show some more evidence for that in a minute, that that's more true of people who are poorer and more deprived than of those comparatively less so. But what's going on behind that? Do you just have to look at the green space? Do you have to go in it? How often do you have to go in it? These are the kind of questions we're interested in. One of the suggestions is that it's physical activity in that green environment that makes a difference, and we've seen some evidence already to support that. We know that when we're in a natural environment, often we're not static, we're moving, we're walking. So if it encourages us to walk, that's good. We may feel more like walking and being active in a pleasant green environment than in a busy urban street or a confined space. And we know also that when we're physically active, that has a good effect on our mental health as well. Mood and stress are affected by being physically active in beneficial ways. So there is some evidence for that, and some of the research that I've been involved with sort of adds support to this. This was research involving older people, age 65 plus, and we were looking at public and neighbourhood open space near where older people lived. And slightly different qualities in the environment were important if people were going out for recreation, going out just for the pleasure of it, than if they were going out to get from A to B, for walking for transport. And the kind of things that people told us won't surprise you perhaps. For recreational walking, people want a pleasant open space, cleaner, well-maintained, attractive trees and plants, but also good for social opportunities, children's play and chatting with people. And they also want the negative things to be dealt with as well. And I'll come back to this in a minute, but one of the challenges that we face in our society is actually that public open space is often a contested territory where young people are seen as problematic, even if they're not doing anything particularly wrong, but just by their behaviour are seen as challenging and perhaps might be off-putting for older users. So there are problems here that are not just about the physical environment, but about the social environment as well. The quality of the paths to local open spaces make a big difference to people's use of those greens and natural environments. So it's not just having an attractive park or open space, it's what's it like to get there. Will it be pleasant, will it be interesting, or will it actually be a thoroughly unpleasant experience that barely justifies going to the place at the end? And when we get there, as we get older, we might want to rest, we might want a toilet. This, of course, is true not just for older people, but for many young and old. So these kind of facilities can make a big difference to how much green space is used. But essentially, we see a link between green space, physical activity, and health for this age group as for others. Social contact in a natural environment is also something that is considered to be an important part, perhaps, of that link between the two. It may encourage people to be more active and improve mood, but also we're much more likely to bump into other people informally when we're in an outdoor environment than when we're indoors. And the park or public open space may be the place where this kind of interaction, this informal interaction, can happen. Many older people live on their own. This may be a chance for an informal interaction, just a hello and what a lovely baby, with someone that you don't know, but that social interaction may be the one time you talk with someone else in your day, and that may make a big difference to how you feel about your life as a whole. Some interesting research from the United States has shown that in looking at public housing in Chicago, where similar kinds of built environment and similar kinds of populations within them, mostly quite deprived, in public housing, Some of the open space was rehabilitated with grass and trees, others not. And they found a significant difference in the amount of use of open space and social activity, lower antisocial activity, more positive social activity. And this was particularly true for women. So that green environment did seem to enhance the social cohesiveness of that population. And there's also some theories that suggest that at a psychological, at a biological level as well, we have a response to the natural environment. And one of the theories that continues to be of interest to us is being called the attention restoration model, attention restoration theory, developed by Rachel and Stephen Kaplan in the States. And it relates to restorative environments. And they suggest that what's interesting about this, if you look at this, is how similar this is to what Olmsted was talking about in the 19th century. They suggest that the struggle to pay attention in urban environments and the struggle to pay attention often in our work environments, something on the screen, noises going by, all of this means that we have only so much focused attention we can use before we sort of use up the ability to do that effectively. And we need to restore ourselves. And it turns out that the natural environment seems to be particularly good at offering the kind of restoration we need. So it offers us a chance to be away from the source of attention, of focused attention. It has extent, it allows us, without having to work very hard, a sort of soft fascination, which allows us to look at the environment in a way that engages us but doesn't require work from us to do, and is compatible with the needs or desires of the moment. These are the four things that the Kaplans suggest are important for a restorative environment, and they say the natural environment is particularly good at offering these. But others have gone further and suggested that there are independent physiological responses to natural environments, that our bodies are in a sense hardwired to respond positively to natural environments. It's not just about restoring attention when we've been focusing too long on something in a difficult environment. And it's essentially a psychoevolutionary approach that suggests that this is something hardwired into us relating to our evolution. And early writers like Wilson talked about biophilia as one way of trying to describe this theory that we seek contact with nature and we are biologically set up to respond positively to that natural environment when it offers the things that we like, that are good for us. Roger Ulrich has done a lot of work. His most famous bit of research you may have read is about people recovering faster and needing fewer painkillers after they've had an operation if they have a view of a tree from their hospital ward window as opposed to a brick wall. That was a very small sample, that experiment, but it's been much quoted. But he has since worked on a range of other research to show that there are physiological changes in our bodies, even from just looking at natural environments, as opposed to looking at urban or other environments. So there's a suggestion that our body responds automatically to natural environments in a way that may be beneficial to us. And there's some lovely research from Japan that has started to explore this further. Shinrin-yoku, I may not be pronouncing that right, or forest bathing. Now, this is not getting into the water in a forest. This is a traditional Japanese recreational move to take yourself into a wooded environment, often cryptomeria or coniferous trees, and enjoy, you're bathing, you're just physically immersed in the atmosphere of that woodland, of that forest. It's nothing to do with water particularly. And what they've shown is that, you have to practice saying this, psychoneuroendocrine mechanisms are engaged by going into these natural environments in a different way from if you're in an urban environment. So they've done experiments that compare looking at and being in forest and wooded environments. They've done this with healthy young male students, so perhaps only a narrow range of the population, but shown that if you send people for walks in a forest, and they've done this in a number of different forests, as opposed to sending people for a walk in an urban environment, you get different physiological responses that are measurable objectively. Lower concentrations of cortisol, lower pulse rate, lower blood pressure, greater parasympathetic nerve activity and lower sympathetic nerve activity. So these mean that you may be less susceptible to other ill health challenges and problems. Your robustness of health may be enhanced, as well as your stress level reduced by being in these kind of environments. And colleagues have been working here in Edinburgh, based at Heriot-Watt and Edinburgh University, on trying to look at something similar in terms of an objective measure of the response to the natural environment. This is very cutting-edge stuff here. Electroencephalography using a mobile headset. So you can see lots of different sensors on the head here, measure different brain waves that have been shown to be associated with frustration, arousal, engagement, and meditation. And what's exciting about this kit is that it's a bit clunky, a bit weird, but not that clunky and not that weird compared with many other things, but being compared with being stuck in an MRI scanner, which is the only way we used to be able to measure these things. We can send people out into the street or into the park or whatever, and we can measure their brain waves and see how they are responding to different environments. And this is still being written up and reviewed, so this is hot off the press, or not quite off the press yet. And don't worry about the detail of this diagram, but essentially the important thing is this is a walk you might be familiar with, from Chambers Street down to the Meadows, along the Meadows, and then up to Lothian Road. And what we see at the change from this section of the walk to this section of the walk is a reduction in arousal and frustration and engagement, and an increase in meditation. So this is very much like that attention restoration theory that Rachel and Stephen Kaplan were talking about. And when we move from the green space back into the urban environment, the one thing that shows increase is alertness or directed attention. Now this is, objectively being measured, and this is early stages. This is sort of a pilot study, but we're very keen to do some more work with this to see if we can really tap into that difference. But the fact that you can see it in just a simple walk in a pilot experiment, and it shows significant results, is really interesting. Now, one other thing that is important about going outdoors is sunlight. Yes, you don't have to be in a green space to get access to sunlight, but one of the things about a positive environment is that you can have a virtuous cycle if you have an attractive environment that looks nice to go out into, that encourages you to go out into it, and encourages you to stay there perhaps longer than you would if the only place you have to go outside is busy with traffic whizzing by and polluted and noisy and unpleasant. And we do know that we don't get sufficient sunlight in this part of the world, certainly. And insufficient vitamin D, for which sunlight is an important part, can lead to bone conditions, and I gather that we're seeing an increase in problems of bone conditions because young people are spending so much time indoors as opposed to outdoors. But it also is a risk factor for diabetes, multiple sclerosis, cancer, blood pressure, probably heart disease, and is, despite all of the concerns that we have, rightly so, about skin cancer, cancer risk is actually reduced by an appropriate level of access to vitamin D, and sunbathing is one of the ways of doing that. This is why we Scots have to get out there to that sun when we see it. We're just not very good at judging when to get back in again afterwards. But we know that sunshine vitamin D can prevent early diabetes. And high levels of heart disease in Britain may also be caused by insufficient vitamin D. And in fact, some of the health challenges that we see, particularly in Scotland, may be partly reflected in a lack of sufficient vitamin D. And we also know that physiologically and psychologically, seasonal affective disorder can be, and often is, partly a response to a lack of sunshine. So we all need to get outdoors more. And we need to understand the benefit of that. In one of my bits of research with older people in Britain, we discovered, looking at a range of different measures, self-report measures, that people were more likely to be physically active, healthier, and more satisfied with life if they had an environment that made it easy and enjoyable to get outdoors. It's that virtuous cycle that I talked about. And a famous study from 2002 in Japan again showed that it looked at longevity, at people's survival rate who were born from 1903 to 1918, and looked at them in the 90s and looked at how many of them survived over a five-year period, related to how much walkable green space they had around where they lived, and showed a significant relationship. So longevity is increased even in old age by having attractive green spaces to walk in near where you live. Some cutting-edge research also shows that blue light is important. And recently research has shown that the retina in our eye contains a blue light receptor that has nothing to do directly with our vision, but is to do with setting our body clock, the mechanisms that regulate our circadian rhythms, our patterns during the day and during the night that keep us healthy. And these biological rhythms are particularly important for not only us sleeping well, but also issues like depression, possibly cognitive functions, particularly in old age. And one of the challenges is that as we age, often the amount of blue light that gets through our lens is lessened as we have a yellowing of the lens, so that less blue light gets through, so our circadian rhythms can get more disrupted. This can lead to insomnia, which is a very common problem in old age, and perhaps also is associated with cognitive decline. And clearly if older people are staying indoors more, don't get outside enough, then this can be exacerbated. And you can see here a pattern of what is a sort of healthy circadian rhythm. Our melatonin levels are secreted as night draws on, so this should go up as we sleep, and then as we wake up in the morning, our cortisol levels should go up to prepare us for the demands of the waking day. And it's important to look at this cortisol pattern because there's been a lot of research that's looked at short-term changes in cortisol and hasn't perhaps recognised that it is healthy to have a high cortisol level, but only at certain times of day. When you're asleep, it should be low, but when you first wake up, within the first 30 minutes of waking up, your cortisol level should go high, should go really quite high. And then it should drop steeply during the day. And an unhealthy pattern is one that doesn't do that. And we've recently done some very interesting research, again for the Scottish Government, part of a bigger project called Green Health, looking at relationships between green space and health across a range of scales, looking at the amount of nearby green space and stress levels for residents of deprived urban areas. And we did this in Dundee. We worked with people aged 35 to 55 who were not in work. We were interested in people who might be likely to be more at home than people who go out to work, so that if we measured the green space around their home environment, we could have a better chance of assuming that that might have an influence on their health. And what we've done in this research, which is new and different from what's been done before, is objectively measure people's stress levels using cortisol data, but also objectively measure the amount of green space around where they live by mapping it. But we also talk to people. We always talk to our participants, so we do ask them as well how stressed they feel. So we particularly chose people not in work, living in deprived parts of the city. And we found, and we published to considerable international interest earlier this year, a very small initial study, an exploratory study, that showed there was a significant relationship between living with high green space and cortisol. Now remember that diagram I showed you before? Steep is good. So here we've got people whose cortisol level isn't kicking up high enough at the start of the day, so they've got a gentler slope here in low green space and a steeper slope in high green space, and that steeper slope is healthier. What's even more interesting, when we've developed this further using a wider sample, but also still working within one urban environment, looking at people, all of whom are in comparatively deprived circumstances, and the cortisol we've measured using a salivary swab. So you just put a sort of cotton bud in your mouth and collect saliva, and then store that in a cold place, and we collected it for testing later. And we asked people to do this 3, 6, and 9 and 12 hours after waking on 2 consecutive days. So we tried to get otherwise people to live their lives as normal. not to get people, not to take them somewhere else, not to get them to do different things from what they would normally do, just to go about their daily life, but to take these cortisol samples on a regular basis. Now what we see here is the blue, so we've changed colours here. The blue is high green space, the red is low green space. And the first thing to say is that the steeper pattern in both men and women is where there is higher green space. So people, both men and women, are healthier when they have more green space around them. But the patterns that we see in the cortisol are different. Men are showing what is called a more classic sort of high-stressed response, where their cortisol kicks off high in the morning, or comparatively high, not very high, but then doesn't drop steeply. So it stays high instead of dropping as it should. That's sort of conventional, classical stress pattern. What we see in women is a different pattern where they're not kicking off high with cortisol levels first thing in the morning. This is considered to be more associated with long-term stress, sometimes post-traumatic stress disorder. It's a different pattern of stress. What's interesting is this is not just showing what it's like for that day for those people, but perhaps a long-term effect that we're picking up that may be partly related and certainly is significantly associated with the amount of green space. So for women, these are a bit burnt out. Their cortisol system just isn't kicking off properly in the morning, and so they've got a low flat pattern. So that's new research, very interesting because it's showing this objective measures of stress and objective measures of green space are related, but they're different in detail between men and women. Researchers in the Netherlands have shown that there are significant relationships between the amount of green space nearer home and both objective and subjective measures of health. So from around the world, there are different researchers working on similar kinds of things, showing that these patterns are true there too. And Yolanda Mass has called this phenomenon vitamin G as opposed to vitamin D. Vitamin G is your green vitamin that you need. And she's also shown, as we found in other research, that this relationship between green space and health is particularly strong for children and for lower socioeconomic groups. So, is there equity of access to green space if this is so important? I've worked with colleagues at Heriot-Watt University for CABE Space Commission for Architecture and Built Environment in England, looking at precisely this. Our colleagues at Heriot-Watt developed the basis for a report that showed that the quantity of green space, and this is just England now, in urban deprived areas is generally worse than affluent areas, and satisfaction with your local area is worse. Black and minority ethnic communities tend to have less green space, which is of poorer quality. And we know that the higher the quality of green space, not surprisingly, the more likely it is to be used. And we know that poorer communities are less physically active and have poorer health. So overall, that's a pretty depressing pattern. And you can see in this slide, in this graph, you can see very clearly a linear relationship between these are the worst 10% in terms of deprivation, and these are the least deprived, and this is the percentage of neighbourhood satisfaction. So you can see satisfaction with a neighbourhood goes up in a linear relationship, the more affluent you are. And we looked in detail at perceived values and uses of open space and green space in a number of black and minority ethnic populations in the sort of Manchester area of England, in the Midlands area of England, and in London. And there's a lot more detail than I have time to tell you about here, but shown in detail that, not surprisingly, different minority ethnic groups have different patterns of use and different desires and needs from green space. Whether you're a cricket-playing nation or not turns out to be important in some parts of England, whether you have that as part of your tradition, how you want to use space. But overall, we saw there was a desire, even from some of the most deprived and impoverished communities, for more access, better access to good quality green space. Now, this is not a longitudinal study. We can't show that if you improve this green space, it really does make a difference to people's physical, mental, and social health. But the fact that we found these responses from self-report from a range of different communities suggests that there is something in it that people recognise themselves regardless of a range of backgrounds from which they come and a range of different traditions. Another group that feel excluded is teenagers and young people. We did some work, this is the report you can see here for Natural England, looking at the role of world adventure space and natural space in teenagers' lives. And it turns out it's very important for them too. It's just that most of us don't really like teenagers being anywhere around the green space when we're there. There's a sort of societal challenge. You know, teenagers are saying, nobody wants us around. And everybody else is saying, no, we don't, go somewhere else. And they're saying, well, actually, where do we go? Teenagers say, actually, we just like to be somewhere where we're allowed to be. Quite like a green space where no one's going to tell us to get off, actually. One of the interesting things we found from a number of deprived communities where we talked to teenagers was they don't feel empowered to go out and find activities in the natural environment. These are young people perfectly capable of doing a range of activities, but either because of lack of transport or lack of equipment or just lack of understanding of how to go about it, they don't feel empowered themselves to go and find these activities to do them. And choice is important. Being allowed to have options, very important for young people. A colleague, Jenny Rowe, in OPENspace, for her PhD thesis, did some really interesting work looking at natural settings for young people with behavioural problems who've been excluded from mainstream schooling, compared with those who hadn't, and looked at forest school, which is a version of a school where once a week the children are taken into a forest environment, given much more freedom to do what they want within that environment, but mainly enjoying a natural environment that has the qualities that a school classroom doesn't have. And perhaps not surprisingly, the forest setting was advantageous in relation to anger, stress, happiness and energy. All of these measures were better. What's also interesting is that it made more difference to the people with behavioural problems. Those young people really responded much more positively to the natural environment, although it was also beneficial for those who hadn't been excluded from school. So again, what we're seeing here is the effect of green space seems to reduce the inequities in healthful benefits from green space. And that seems to be a really important contribution to public health. So we've done some research which tries to understand what kinds of things young people and teenagers do like. And these are just some of the quotes from research we've done with Forestry Commission. Places to make dens, places for teenagers to hang out with their peer group without having to have the oversight of adults can be very important at certain stages in development, and we need to recognise the need for these and not just try to exclude them. One of the interesting things when we've done qualitative research is how even teenagers are nostalgic. You know, things aren't like they used to be, but when I was a kid, we used to do all these lovely things. Often, for many people, if you ask them what their favourite things were in their childhood, it's often some kind of engagement with the natural environment that was a very vivid experience for them. And even the water of Leith in this memory seems to be a very wild rural environment in this young man's memory. So again, I haven't got time to go through this in detail, but there's a lot of evidence that suggests that in childhood development and at critical stages in childhood, access to green space is really important for development in a whole range of ways. But also there's evidence that if you have that good access in early childhood, you then have a resource that you can turn back to when you're feeling stressed or when you have anxiety in teenage life and in adult life. It seems to be a resource you can use again and again later in life, but you need to have become familiar with it in early childhood for that to be seen and to be familiar to you as a resource that you can turn to. So what does this mean for public health? Well, the cost of poor mental health is huge. This is a rather terrifying estimate, 10.7 billion. Even if you look at just some of the figures down at the bottom, you know, nearly 2 billion for health and social care, over 3 billion for output losses. Developing new medical products, the sort of pharmacological approach to health, is something that we're very familiar with now in our developed world, but it's a very expensive proposition. Here's an estimated $802 million over 15 years to develop a new product. And yet we know that the natural environment can offer all kinds of things that may be very good for our physical and our mental health. These are some quotes from research we've done in woodlands in Scotland with unemployed young men and women that just reinforce the contribution that green space can make to health, to allow people in very difficult circumstances, no job, you don't want to be in a place where you have to be in consumer mode, where you have to spend money in order to enjoy yourself if you're worrying about shortage of money. Green space allows you to clear the head, to get away, to get it out of your system. And there are projects that Forestry Commission Scotland is working on, woods in and around towns, investing in to try and address and provide this alternative sort of health service, a natural health service, as it were. Investing comparatively small amounts of money in any particular place, 10 to £100,000 perhaps, rather than millions or billions, but they're able to cover quite a wide area, different parts of Scotland, focusing on urban areas, because that's where most of the people are, and focusing on creating a difference, making a difference to the community. In terms of shrinking cities, there may also be some opportunities too, and I'll only briefly touch on this, but this is a map of both growing, that's the orange, red and brown, and shrinking, the blue, cities in Europe. And you can see we have some in Ireland, in the UK, in the Mediterranean, also Eastern Europe. But one of the things that may be resulting from these shrinking cities, in the developed world at least, is that there may be opportunities to create more green space within the existing urban fabric. Harder to do in a rapidly developing city if you don't build it in from the start. But in a shrinking city, you can see here's the maximum, 2009, the maximum urban development, and it's declining. There's more open space or potential green space predicted for 2015 and 2030 in Milan. And we see an example here from St. Louis in the States, where a shrinking city is being looked at by landscape architects who want to see how they can develop more green networks within the city to offer a healthful environment. One of the challenges that as landscape designers we're facing at the moment is to still understand just what is the right amount of green space. Does it need to be a big area, or is this a small area as good as a big area? What configuration is best for it? Some people have done research looking at quantity and quality and distance of green space and shown all of these are important. One of the things that is underlined time and time and time again in different research is that it needs to be really close by if you're going to use the green space and it's going to make a difference to you on an everyday basis. These are results from research we've done with older people, but there's research that reinforces this with young people, with children, and in a range of different countries and contexts. It needs to be within 5 or 10 minutes of where you live, and that's walking, if it's going to make a difference to you on a daily basis. If it's further away than that, however attractive it is, you're not going to access it, you're not going to access its benefits on a regular, on a daily or several times a week basis. So it's got to be close by. We know that. The challenge is what shape, what configuration, just how much is enough, we're still working on. And finally, just looking at the kinds of things that we're researching at the moment, we're looking at the impact of this woods in and around towns, this Forestry Commission Scotland initiative, to see whether the physical changes to the woodland and or the social activities that are then encouraged in those woodlands make a difference to people's health. We know that physical signs of welcome and social support are very important. These kinds of changes, these kinds of interventions can make a difference. And we're working on a public health research project at the moment to look at how, compared with a control site or a number of control communities, communities where woodlands are improved physically and then social engagement is encouraged to get people to use those woods and feel comfortable in them and to feel that they have a contribution to make in looking after them, to see how much difference that makes to the community's mental health and their stress levels in particular. And I will finish by a slightly shameless plugging of a book, but also to say, perhaps more importantly, that mentioned a range of research here. By no means all of it is research that I'm personally involved in, but our website for open space there does give you access to a number of the research projects that I have mentioned if you want to follow that up and are interested in more. And I'll finish there, very happy to answer questions.
Thank you, Catherine. Questions, please. We're going to
make people here.
Right. Anybody have a question? Yes.
The anecdotes you showed just 2 or 3 minutes ago. I mean, was that an old population, or did you do any on say people in their 20s, who are part of the digital era, who are very much sort of got lots of things to do at home, and maybe tempted not to go out?
Is it that one you're referring to?
Yeah. What sort of age were the people you were asking?
These were comparatively young, probably in their 30s or 40s. We do know that there is a phrase that's been coined, nature deficit disorder, by Richard Louv, to describe one of the things that is concerning about the younger generation today, who have grown up in a digital community where perhaps the most attractive things are electronic boxes in your bedroom, rather than, for want of any of that, mucking about in the garden or in the local park. And I think we don't fully know the consequences of that, but there is great concern that this is leading both generally to children being indoors more, but also that they may, because of that, feel less able to take advantage of the natural environment later in life as well as when they're young. Up there, yes.
The arguments in support of this seem quite wide-ranging and well established. But just 2 weeks ago, there was a lecture about the developments of carbon-neutral buildings and things like that, and they're saying that actually the regulations on that are being diluted, if anything. How confident are you that actually there's a willingness and there's a weight behind actually implementing more measures to help to support this?
The fact that people who are reporting on public health issues are taking this seriously is one sign. It may be that it's seen as a cheap option, but hey, if it works. Harry Burns, the Chief Medical Officer in Scotland, is very much behind the notion that environment is important and we need to be paying attention to environment again in Scotland. The Marmot report in England reinforced the importance of access to green space, and internationally, as you'll have seen from some of the research at least, it's recognised that this is potentially a population-wide way to intervene for an urban population to enhance health. It's much harder to do within an existing urban environment, and that's why the shrinking cities is an interesting phenomenon, because that's one way where you can comparatively cheaply make a difference, increase the green space within an urban area. I think the challenge is for rapidly developing urban areas and countries with rapidly developing cities to see the importance of green space being built in as that city develops, rather than worrying about it only after we see the problems of urban areas. But I think the bottom line will be economic as well. And in our research, we're now using health economists to try and make some of those calculations a little bit more solid, because ultimately we all know that in many parts of the world, that's going to be the winning argument.
Gary.
I'm just wondering if there isn't a kind of a direct conflict between this and the green belt planning, because I mean green belt planning is implicitly concentrating your new building, new development within cities and keeping a circumference that's green. This you really want the opposite, don't you? You want to infiltrate green right through the city.
See,
get rid of the belts.
landscape architects love this kind of discussion. The Copenhagen model is not green belt, but green fingers, where you have, and actually Patrick Geddes is the father of modern planning, a Scot, was also interested in the idea that you have fingers of green that come into the city. So you still perhaps want a dense urban core to, is seen as sustainable because it allows for good transport systems, for example, and for a walkable city. And in Edinburgh, we're very fortunate in that we have that for at least the central area. But nonetheless, access to green space is important, even if you live in the centre. So a green belt may not be the best way of providing that. And indeed, the green wedge, that was one thought from in Edinburgh, made me making a virtue out of necessity, having Arthur's Seat in the middle. But the idea that you have green areas coming into the centre, the Water of Leith walkway, those kind of things, small but better than nothing.
Can I ask you, if you take your whole discussion then and say people therefore who live in the country all the time, in a rural environment all the time, should be extremely healthy, should be mentally superhuman, etc. But that isn't the case. So it surely isn't the only answer, is it?
No, it's certainly by no means the only answer. And if you're unemployed, or if you're living in a rural area with bills all around you and no means of paying them, those economic and family circumstance things will make a big difference to your health, no doubt about it. Green space isn't the answer to everything. However, some of the worst ills that we see do seem to be more associated with urban areas than with rural. And I think the key thing is that it seems that access to green space mitigates the problems of urban living and deprivation for the people that suffer it most. So it doesn't prevent those things. It's still the case that if someone is living on a very low income in deprived urban environment with very poor physical quality, their health is going to suffer. But a green space in there might make more difference to them than to someone who's better off.
Any more questions? Yes.
You showed a picture of a Glasgow slum in 1990. I would contend that we can look closer to hand for some slums, which I call 21st century slums, which are the apartments being built in Granton and Leith, in that there's almost no green space around them.
I'm not familiar with the detail. I know there is development happening in Granton and Leith, but certainly my research and those of colleagues would suggest that it is important to think about it wherever we're developing. So yes, dense urban environments may be good places for people to live for many reasons, but we still need to have access to green space within those, I would suggest.
Down at the front.
Apologies if you've said this already, but how big does the green space have to be for us to benefit from it? Because I'm from London, so we have sort of community gardens near me, and then you've got the biggest park that I live in is Regent's Park, but that's like a half an hour walk away.
Yeah.
So how big does it have to, would I benefit more if I lived near Regent's Park, or am I benefiting now by living through the small community gardens?
Well, that's the big question. And we don't fully know the answer to that. That's something that people are still researching. There's some evidence that it needs to be really close by, as I said, for you to use it regularly, but that a bigger park that has more options will perhaps allow you to do more things like walk more or whatever. So ideally what we need is a range of options and a range of spaces. Ideally, you would have something very close to you, but also the option of something perhaps within a kilometre or two that allows you to go for a run or play a game of football or do some of those things that a small space can't necessarily satisfy. Follow-up question? Oh,
Here, same person.
So you're saying that basically physical activity is the key it's the key factor of the green space in our health. It's not, you're saying running and going for walks and doing some sort of physical activity sort of the key behind why you're promoting green spaces. But what about the actual, like, just looking at the sort of landscape?
Yeah, well, great questions. We're trying to find that out as well, and we're in the middle at the moment of analysing some data, questionnaire data, that is from the same communities that we did the cortisol work on. But we also asked people what views they had from their window. We haven't finished analysing that, but we want to know whether the amount of green space near where people live is making a difference because they go in and run in it or walk in it, or whether they just look at it. We don't actually know. And it may be that just looking out of your window at a natural environment gives you a lot of that mental restoration that is important for health as well. So, jury's out.
Is there an example in the... is there a difference in the benefits of very stylised examples of landscape architecture compared to sort of actual wild natural spaces?
I'm not aware of any research that has looked at those as specific variables to study. But I think we do need to get down to the nitty-gritty. We do need to have a better sense of the qualities that, in detail, that make a difference. If that's the essence of your...
I think of, like, because you're talking about reinstalling green space in shrinking cities, and I think of there's an example of an old railway in New York that they've sort of put the path, and it's sort of like it's very trendy and fashionable, and it looks very trendy and fashionable, and that sort of seems very different to actually being somewhere actually wild. But
the High Line in New York, it's a great example of a sort of urban park that's been created on an old railway line that's in some parts of it is up above street level, quite high, and has been enormously popular. I mean, I think, this idea that close access to green space for mental health perhaps ties in with that. It may be that just being able to get into a bit of green space or a bit of place away from everything when you're feeling really stressed out, even if it's just for 10 minutes, sitting with a cup of coffee, or half an hour strolling with a friend and just getting away from it all, seems to be a really important thing that green space offers in a way that other kinds of urban environments don't. So I'm not sure whether we'll ever be able to sort of specify, this kind of design gives you health and that kind of design doesn't. There will be different combinations of factors and context in all of these. It's a complicated thing. Remember that diagram at the beginning. But I hope that we can start to drill down into a bit more detail about, how much is enough? Does configuration matter? Is a long, thin strip just as good as a big, wide area? These kind of things we're still exploring in research, and we don't really have the answers yet.
I don't know if this is really a question, but you were making the correlation between economics and green space earlier in terms of health inequalities being smaller in areas of the income. With the exception of areas of social housing, is that not a bit of a catch-22? Because as soon as there's more green space in an area, that's going to start pushing up house prices, and it's going to start defining the people who live there. People who are on better incomes may have less economic stresses, and therefore that's going to impact on their mental health as well. Whereas people who are on the lower income, house prices are going to be a bit more run down, they're going to be a bit more urbanised, there's going to be less green space. Is it not a catch-22?
Potentially it is, and I think you're referring, if I understand your question correctly, partly to the challenge of gentrification that often happens when you improve an area and then it becomes more attractive and house prices rise, and when people are looking to buy new housing or to move into new rental areas, they can't afford places they used to. And that can be a challenge. On the other hand, all of the research that I've been showing you about relationships between green space and health always take into account socioeconomic status as the first thing that you have to take account of, and then look for any effect of green space beyond that. because we know that socioeconomic status is the one best predictor in the sort of general demographics of people's health. So that means that we can show that people who are equally poor, equally deprived in a range of measures, who have more green space will be healthier than those who have less. It doesn't address the challenge of gentrification, but it does suggest that we shouldn't just accept that deprived people and poorer populations should have worse quality environment. It comes back to those bigger questions of environmental justice, health inequities. A high quality, well-maintained physical environment is important for all of us, not just for the rich.
Do you think that's something that's going to be achieved? Do you think that trying to get those green spaces into these low-income areas is realistic and achievable?
It's only one example, but this Woodlands initiative that the Forestry Commission Scotland is working with is one attempt to try and do just that, working with local communities. And there are other initiatives as well. It is, of course, a challenge in an era of declining economic income for many cities. Not easy, but I think it's important.
I'm aware that, has anybody got one last burning question they must ask Catherine? No, well, please join me in thanking Catherine for a wonderful, stimulating lecture on a fascinating subject. Thank you very much.
Thank you.
Thank you.
This production is brought to you by the University of Edinburgh.